Hello, everyone, and thank you for joining us today for this webinar, Nonprofits and the Washington State Paid Family and Medical Leave Laws. My name is Pragya Madan. I'm the Program Manager for HR Consulting Services here at 501 Commons. Commons' mission is to boost the capacity of nonprofit organizations to thrive over the long term and effectively serve the community. Since 1989, we have supported the success of nonprofits in Washington State by providing management, human resources, and technology consulting, along with contracted HR, finance, and technology support offerings in all over 30 plus service offerings. 501 Commons offers leadership and staff development through executive coaching, monthly training on areas spanning from building leadership skills, diversity, equity and inclusion, and communications. Our services are designed with the model of a healthy nonprofit in mind. We focus on the 5 elements: strong governance and oversight, good management and a healthy organizational culture, the resources to carry out our mission and accountable management of funding, communication and relationship, effective and efficient program, service, and administrative systems. We have a free assessment that you can take, and you can learn more about 501 Commons by visiting our website, www.501commons.org. We are happy to have this opportunity to share about the Washington State Paid Family and Medical Leave Law. Washington will be the 5th state to offer paid family and medical leave. While the benefits start in 2020, employers have some mandatory actions that need to happen starting 2019. So learn more about those, and we'll talk about how to communicate those details to the staff. I'm really excited to have this presentation by the Washington State Employment Security Department in partnership with 501 Commons. A few considerations. We have allocated some time towards the end of the webinar for question and answer. Please keep sending your questions. You can type it in the small question box there, and we will address as many questions as possible. Thank you to those who had submitted their questions at the time of registration. Now let me introduce our presenters. Jason Barrett is the lead policy analyst for paid family medical leave with Washington State Employment Security Department, ESD, where he is integral to the development of regulations and policies around all aspects of PFML. He is a veteran of the public, private, and nonprofit sectors with experience in many policy areas, including government data transparency and economic development. Jason is passionate about ensuring the success of paid family and medical leave, both in Washington and around the nation, because he believes that workers should not have to choose between a paycheck and providing vital care for themselves or loved ones. Our second presenter is Claudia Malone, SPHR. She has over 30 years of broad generalist experience in human resources with diverse organizations such as Neighborhood House, Packard, Dable, Triad Associates, and now with 501 Commons as HR consultant, working with various nonprofits of varying sizes and service sector. She is passionate about improving how organizations lead their human resources to build and foster an inclusive and equitable workplace. Claudia's expertise include employment law, employee relations, compensation and benefits, training and talent development, recruiting and retention, and performance management. Over to you, Jason.
All right. Thank you all so much for joining us today. My name is Jason Barrett. I am the lead policy analyst for Washington Paid Family and Medical Leave. I want to start by thanking 501 Commons for having me here today. I have a fair amount of nonprofit experience on my resume, and I'm very familiar with some of the unique challenges that nonprofits face, especially smaller nonprofits, and some of the administrative and HR challenges that they face. So I definitely want to applaud and thank 501 Commons for all of their amazing work. I will have a presentation to go through here that'll go probably about 20 to 25 minutes. And I will be more than happy to address any questions that I miss in my presentation at the end and after Claudia gives her presentation as well. So with that, I will go ahead and dive in with just kind of a brief history of paid family and medical leave here in Washington State. The law that passed last year, contrary to popular belief, is actually not the first paid family and medical leave bill that passed here in Washington. That happened in 2007. That paid family and medical leave program, however, was unfunded, which, if you ask me, is not the best way to operate a program with the word paid in it. But that's just one man's opinion, so take it for what it's worth. In 2015, we received a federal grant to begin exploring the feasibility of a funded paid program here in the state. That law did pass last year as part of the special extended session that I'm sure many on the webinar will remember so fondly from last year. Here we are in 2018 with program rollout and implementation and technology builds and policy implementation as well. 2019 will see the beginning of premium assessment and reporting. We'll get into that quite a bit here during this presentation to make sure that employers are as ready as they can be for what's expected of them beginning next year. And then in 2020, eligible employees will be able to begin claiming benefits. So that's just kind of a quick path of paid family medical leave up to this point. At Employment Security, we really are strong believers in this program, and the reason why is because it offers stability for both employers and employees in times of generally high stress. There's a significant amount of research that indicates that employees who receive a payment while they're on leave for family or medical leave are much more likely to return to their employer after their leave expires. So in addition to offering some financial stability during a high stress time for the employee, it also offers some stability to the employer, knowing that that employee is more likely to return so that they don't have to re-engage in the hiring process and retraining if that employee decides not to return. So we really feel it offers a sense of stability to both employees and employers. This slide is just a quick rollout kind of our implementation process. I won't get into it too much, but just sort of a quick timeline of where we've been, where we are, where we're going. You can see some of our key milestones that I mentioned. 2019, premiums and reporting begin, and then in 2020, benefits are available to eligible employees. You can also see kind of a quick timeline of our rulemaking process. We are doing rulemaking in phases, as you can see, and you can see under each phase what's covered in each phase. And I'll talk about our rulemaking process and how you can participate in that process here in a bit. So one misconception that I have noticed since this law passed, and I know this will be of particular interest to those in this webinar, is how the law applies to nonprofits. And the short answer is that it does apply. There is nothing about being a nonprofit in and of itself that excludes or exempts an entity from participating in this program. The only exemptions for this program are the US government and its employees, federally recognized tribes, and self-employed individuals, talking about sole props, joint ventures, partners, independent contractors, those types. Tribes and self-employed individuals can opt in to the program if they would like to receive the benefit at some point, and they would basically be treated as an employee. But for the most part, they will not be automatically enrolled, whereas the vast majority of workers and employers in the state will be. As I mentioned already, we have two kind of key timelines that we're talking about here. The first is beginning right here in January. It's coming like a freight train. So we want to make sure that employers are prepared for what's expected of them beginning in 2019. We'll begin assessing premiums, and employers will need to start submitting their employer reports to the Employment Security Department. And then in 2020, benefits will be available for employees who are eligible. So let's talk a little bit about kind of the program itself and what we're talking about when we talk about paid family and medical leave. We're talking about two kind of main buckets of leave here. The first is family, which covers caring for family members who have a serious health condition, birth or placement of a child, and time to bond with that child. And then certain military-related events. This generally refers to things like short notice deployment, where the spouse or family member of an active duty service member who is being deployed might need some time to make financial arrangements or childcare arrangements or other kinds of family arrangements that might be needed since that deployment has occurred. The second bucket is medical leave, which refers to the employee's own serious health condition. There is a weekly benefit along with the leave. That benefit will range at first from $100 to $1,000, and the amount of that benefit depends on a few factors. It's a proportion of the employee's weekly wage and also the ratio of that amount to the state's average weekly wage. So each year, that number will change along with the state's calculation of the average weekly wage in the state. It's a very long, complex formula that I would need an abacus and an easel to walk through. But you can get some more information about the exact math behind the benefit calculation on our website, which I will refer you to here shortly. And then the amount of leave available, the length of the benefit is 12 weeks for medical leave, 12 weeks for family leave, or a combination of up to 16 weeks between the two buckets. There's also an additional 2 weeks of medical leave available in extreme circumstances that are related to disability caused by a pregnancy. Let's say an expectant mother is ordered on bed rest by her doctor. That could potentially be eligible for an extra 2 weeks of medical. So all told, there is the possibility of 18 weeks in extreme circumstances, but in most cases, we're talking about up to 12 weeks of either one or up to 16 weeks of both. This is a list of those who are eligible for care under family leave. It is a bit different. It is a bit more expanded than what FMLA, the Federal Family Medical Leave Act, allows. So we do want to highlight those differences here and make sure that folks do have a comprehensive list of those who do qualify as a family member for leave under the family side. I won't list these out individually since I have no doubt that folks on the webinar can read, so I won't spell them out, but this is just a quick list to make sure that everyone's on the same page with regard to who qualifies as a family member for family leave purposes. So this is just kind of a quick life cycle of the claim. When an employee has worked 820 hours in the qualifying period, for any number of Washington employers, they are eligible for the benefit. Once they qualify and they experience the qualifying event, then they will file the claim with the state. They will notify their employer of their intent to take leave, and then they will begin receiving the benefit from the state. So this is just sort of a step-by-step process of how a claim, of how the life of a claim will work. It's a bit different for unplanned leave that generally relates to the required notice given to the employer. For unplanned leave, notice must be provided as soon as is practicable. Let's say if there's a serious injury because of the car accident, we certainly don't want to require the employee's first phone call to be to the employer rather than to 911. So we do have a little bit of flexibility there in the event of unplanned leave. For planned leave, that's let's say you have a general idea of when you might need leave because you know when the expected child is to be born, or if there's a surgery plan, a medical procedure, then you would be expected to provide notice to your employer 30 days in advance of the leave occurring. As I mentioned, 820 hours in the qualifying period is what an employee must work to be eligible for the benefit. The qualifying period is a 4-quarter period. It is either the first 4 of the last 5 complete calendar quarters or the last 4 complete calendar quarters. If the employee works 820 hours for any number of Washington-based employers, then they are eligible for the benefit in either of those 2 timeframes. The premium that the Employment Security Department will assess is 0.4% of all gross wages paid in a reporting period. We have filed rules with the code revisor that are still not final, so I'll put an asterisk next to this. But the way that we envision the process working for reporting is that the employer will report all wages paid to each employee during a quarter, and then they will total up, the department will total up all of those wages, those gross wages paid to all your employees in that quarter and apply a 0.4% assessment on that number. You can see the breakdown of the assessment here. Family leave accounts for 1/3 of the premium. Medical leave accounts for the remaining 2/3, and there is a further breakdown that determines whether the employee or the employer pays which part of the premium. When you mash all those numbers together, what you're looking at is about a 63% premium liability on the employee and a 37% premium liability on the employer. So that's 37% of the assessment paid by the employer and 63% by the employee. Now, the employer is not required to withhold those wages from their employees' paychecks. If the employer wants, as a benefit to their employees, they want to pay some or all of the employee share of the premium, that is perfectly fine. We strongly encourage that, but if the employer does wish to withhold those wages, they can withhold up to 63% of the premium. So for a $50,000 a year employee, the total premium will be about $200. The employee will be responsible for $126.67. The employer responsible for $73.33. Now, I do want to put a big asterisk next to those numbers because small businesses, that's businesses with fewer than 50 employees, they are not assessed the employer share of the premium. So you will only be assessed the employee share. So that comes out, rather than a 0.4% premium, you're looking at about a 0.252% premium for small businesses. And that small business would be entitled to withhold 100% of that amount from employee wages if they chose to do so. So small businesses, if they choose, are not necessarily financially liable for any premiums under this program. They would still need to submit reports and abide by other provisions of the law. But if they chose, they would not necessarily have to pay $1 of the premium on a quarterly basis. This is just a way to kind of break down the premiums a bit more to offer some kind of real number examples. So if an employee is paid $2,500 in a quarter, for example, the total premium for that employee would be $10 for that quarter. And the liability would be $3.67 to the employer and $6.33 to the employee for that employer. Based on the average weekly wage in the state, the average employee will see about $3 taken from their paychecks every week. So that's kind of the average cost to the average employee is $3 a week for this program. As I mentioned, we have filed some draft rules with the code revisor, so I don't want to report these as definite, but we will be requiring wages and hours from all employers. That is a requirement within the statute, so I can say that with confidence that we will require wages and hours for all your employees. And there are some penalties for missing reports and incomplete and incorrect reports, so please be aware of that. And just make sure that you're paying attention to all of the Employment Security Department outreach to make sure that you're doing it right, because that will be your best bet in avoiding those penalties. Reporting is going to look and feel as similar to UI as possible, but there will be a separate process for now. The long-term goal of the department is to combine reporting for unemployment insurance and paid family and medical leave into a single report, or at least something that feels like a single report. We're not quite there yet in our technology build out, so for now there will be a separate process where you will log on to the website and submit your reports and payments independently from UI, but do know that long term we are looking to combine those processes as much as we possibly can. One other difference that small businesses can expect, aside from not being assessed the employer portion, is access to small business grants. There are two types of grants that are available. There is a $3,000 grant available for employers who choose to hire a temporary employee to replace an employee who is out on leave. There is also a second grant that is up to $1,000 for other wage-related costs other than hiring another temporary employee. That could potentially be paying an existing employee overtime wages to cover the work of that employee that's out on leave, training, certification, uniforms, those types of things that an employer might feel the cost of because their employee took leave under this program. In order to be eligible for this program, you have to have 150 or fewer employees. Employers with between 50 and 150 employees are already paying the employer share of the premium, so this next part won't apply to them. But small businesses, that's fewer than 50 employees, who are not paying the employer share of the premium, will need to pay that premium in order to be eligible for the grants. In addition to having to opt in to at least 1 quarter on the front end, if you receive a grant under this program, then you will be required to pay the employer share of the premium for a further 3 years after you receive the grant. So obviously every small business will need to do some cost-benefit analysis to make sure that they won't be paying more for the employer share of the premium in the long run than they received in the grant. Definitely want to highlight that and make sure that they have as much information as possible before they make the decision to apply for that grant. The department will count employees with a simple head count over a 4-quarter period. We will look at the reports that employers submit. We will see how many they report for each quarter, and then we will average the number of employees that they had over those 4 quarters. That's to account for businesses that see a lot of seasonal hiring. Retail in particular will see bumps in employees during holiday months where retail really kind of explodes. So we wanted to account for that when we have our employee count. Whatever that number is, we will calculate that number every September 30th. And whatever that number is, whatever that designation of either a small business or a not small business is, that will be your designation for the next calendar year. So if on September 30 we run the numbers and the number comes out to 47 employees, then you will be considered a small business for the entirety of the following calendar year. There is a lot of confusion about this program with paid sick leave and FMLA. Paid sick leave, which also went into effect earlier this year, is an entirely separate program. It is managed by L&I, which also manages workers' comp. So those certain employers might have some familiarity with L&I already. They are responsible for regulating paid sick leave. That is the accrual of full pay time off that an employee can use. I believe the accrual rate is 1 hour of sick leave for every 40 hours worked. So that is a completely separate entitlement from this program. There is also the Federal Family Medical Leave Act, which I referenced earlier. That, for those who might not know, that is a federal program that allows for 12 weeks of job-protected unpaid leave to certain employees. We do have job protection provisions in our law that are separate from FMLA, so we are not relying on FMLA for the job protection provisions of our law. The requirements to get that job protection are pretty similar to FMLA. For employers on the state plan, the employee has to have worked 1,250 hours for that employer over the previous 12 months, and the employer has to have at least 50 employees. So it's very similar to what you might already be familiar with. But just know that they are 2 separate programs, and they are designed to run concurrently. I can't say in every case that the employee will only get one and not get both. There could potentially be situations where they might be entitled to both. We're still working on that at ESD, and we are going to do some rulemaking around that later this month. There's also in statute a carve out for employers who have a CBA with their employees. Any collective bargaining agreement that was in effect on October 19th, 2017, that employer is not responsible for anything under paid family medical leave. The employee does not have access to the benefit under paid family medical leave. All rights and responsibilities under paid family medical leave are exempt for those employees and the employer as it relates to those employees until that agreement expires or is reopened or renegotiated. So if you have a collective bargaining agreement that was in effect on, let's say, July 1st, 2017, until that agreement expires, none of this applies to the employer and none of it applies to the employee. Even in situations where some employers might have multiple bargaining units, some employees covered by a CBA and others not, the employer would basically just report and pay premiums for those employees who are not covered by that CBA, and they would report and pay, or they would not report and pay for those that are covered by that CBA. But again, that only applies to CBAs that were in effect on October 19th, 2017 and are still in effect today. I mentioned briefly earlier that those who are self-employed are not automatically enrolled in the program. They do have the option to participate if they choose to do so. They have the same eligibility requirements as any other employee does. They have to work 820 hours, and they will end up paying the employee portion of the premium, but they would be eligible for the benefit just like anybody else if they choose to opt in. There's also a concept in the law called a voluntary plan. That's essentially a self-managed paid family and medical leave program that exists within the employer, within the employer's benefit package. For those who do wish to implement a voluntary plan, nonprofits are free to do so, just like any other business, organization, or government entity. But the mantra for voluntary plans is same or better. And what that means is that voluntary plans have to offer benefits to the employee that are at least the same or better as what the state would require. So when you submit your application, which outlines what your benefits are, what your premiums are, and everything that we require, you will need to show that your benefits are the same or better and that you are not withholding more from your employees than the state would. So even if your benefits are better under a voluntary plan, you still cannot take a dollar amount that is higher than what that employee would see withheld if they were on the state plan. There is a $250 fee for each application. The plan has to be reapproved for each of the first 3 years, and then after that, only if there is a change to the plan that is not required by statute. And we would strongly encourage you to head to our website, which is paidleave.wa.gov, for information on the application process, what information has to be submitted in order to be approved, and some more information about how that process works. There is also a lot more to come from PFML over the coming months and into 2019 and 2020. As I mentioned, we are still finalizing the reporting requirements right now. They have been filed with the Code Revisor, and I'll show you how you can see those draft rules here in a minute at our rulemaking site, whereas our rulemaking site is kind of our primary hub for external communications with employers and other stakeholders. I'll show you a link to that here in a moment. We are breaking up, as I mentioned, our rulemaking into phases. Benefits rulemaking is ongoing right now. We're just now getting into phase 4 of rulemaking, and you can see some information on that on our rulemaking site as well. We are also live with our customer care team. They can talk about voluntary plans, Q&As around the law, and other aspects that you might not be familiar with. And I'll show you a phone number for them here in a moment. We also have other pre-recorded webinars that employers can watch at paidleave.wa.gov/employer-webinar. A lot of great information there where some of our staff kind of walks you through the law, what employers need to focus on as they move into 2019, how voluntary plans work, and a lot of other information that I've shared with you here, but some additional details as well. So as we move towards 2019, we definitely want to make sure that employers are getting ready to begin withholding premiums if they choose to do so. And this is important because you cannot retroactively withhold premiums from your employees. You have to do it on a paycheck by paycheck basis. And so we definitely want to make sure that employers are aware of the math that the Employment Security Department will use to calculate the premiums, so that employers can see how much they can withhold from employee wages if they choose to do so. So that process will begin in January if employers want to begin withholding. First premiums and reports will be due in April, and that'll be on a quarterly basis, very similar to UI. So for Q1 2019, that's January, February, March, first payments and reports will be due at the end of April, and then Q2, April, May, June, reports premiums will be due at the end of July, and then similar cadence for the rest of the year. It's the last day of the month following the end of the quarter. And then our kind of primary role right now is feedback and outreach. We really want to hear from you. So we have our email address right there, paidleave@esd.wa.gov. Any question that crosses your mind, anything that's unclear, anything that you would like some clarity from ESD on, please do not hesitate to send an email to that number. We also have our customer care line, that 833 number that you see right there. Our primary website is paidleave.wa.gov. A lot of information there that you can see about voluntary plans and what math to use when you're looking to withhold from your employees. And we get pretty deep on that website. So a lot of questions hopefully will be answered just by checking out that website. Also have some social media and newsletter links there if you want to follow us and kind of keep up with the latest news. And then our rulemaking forum, as I mentioned earlier, is right there at the bottom right. That's bit.ly/comment forum. You can see our draft rules there. You can see what rules have gone into effect. You can see our rulemaking timeline. And you can also submit comments on everything that we are thinking about when it comes to rulemaking. We do have multiple phases, as I said, and we do have multiple drafts of each phase that we make public to gather feedback from employees and employers alike to see, if what we're thinking about doing is, it's a good idea, if it's a bad idea. We really want to hear some feedback on our proposed rules. Our next kind of rulemaking highlight date is actually this Monday, the 15th, where we are having our phase 4 listening session. Listening sessions are kind of an informal way for employers and employees to give us an idea of what we should be thinking about before we start putting pen to paper on the rules for that phase. So we really want to gather some feedback and some bullet points to make sure, oh, that's right, this employer said that they were looking to have this particular aspect of a rule outlined and thought of as we're making the rules. So we take comments very seriously. We consider everybody's feedback as we are writing our rules. So again, head to bit.ly/comment forum to get the latest on our rulemaking process. And I think that is it for me. So I will hand it over to Claudia.
Thank you, Jason. This is Claudia, and I'm going to take you through a few steps that we believe that employers need to be thinking about now in terms of getting ready for 2019. My list is very similar to what Jason has. I'm just putting them in a little different order in terms of what I think you need to do first. So what I believe you need to look at first is to determine if you have a quote-unquote voluntary plan. A voluntary plan is not just having sick leave, vacation, or paid time off. A voluntary plan is an actual medical or family leave program where you offer payment. For example, if you had a short-term disability plan, that possibly might qualify as a voluntary plan if it offers the same level of benefits as the state plan is going to offer. So you need to take a look at that if you have one. If you are thinking about doing it and don't have a plan now, you really need to get moving and get that put together, because you only have a few months to get that put together and approved by the state. Question is, even if you have a voluntary plan, do you want to continue it, or do you want to opt into the state program? There are pluses and minuses to both ways. You need to just do the analysis, figure out which is the best way to go. And then remember that if you are going to create or maintain a voluntary program, you need to complete the application and get approval for that by December 31st. The reason is that if your plan is not approved, then you must start paying the premiums, obviously, unless you've got less than 50 employees and don't have to pay the premiums. So you need to get that moving right away. There obviously is a timeline once you've submitted the program before it's approved. I know they're going to be working very hard to get those approved as quickly as possible. This is not something you want to be submitting Christmas Eve. So you want to make sure you go through it and figure out which way you're going. The next step you need to consider is, and most of our clients are under 50 employees, so most of our clients, a good chunk of nonprofits have fewer than 50 employees. So you need to determine if you are going to pay the employer part of the premium. Obviously, you can be exempt from that. Just remember that if you don't participate and pay the premiums, then you will not be able to participate in that grant program that's going to offer funds to cover some of the costs if you have, if you need to hire a temp to cover while somebody's out on family or medical leave, or if you have other costs such as overtime to cover the work that's not getting done by the person who's out on leave. So there is an analysis that needs to be done. It's a financial analysis. You've just got to crunch the numbers, figure out if it's worthwhile to participate in paying the premiums. The second thing you've got to figure out, and we've gotten a lot of questions about this already, is whether or not the employer can pay the employee portion of the premiums. And the answer, of course, is yes. Employment Security is not going to be concerned with where the payments are coming from. They're just going to want to see those payments are getting made. Other than their concern, obviously, is going to be that an employer is not withholding higher premiums from the employee than they are allowed by law to withhold. Other than that, though, it is up to the employer to determine. There obviously is a very positive employee relations aspect to paying the premiums. But as with all benefits that you offer to your employees, you need to consider being able to continue to make those payments, because it's very difficult to start out saying you're going to pay the employee portion of the premiums and then find that you can't sustain that financially and have to take it back. That doesn't go over well, as you can imagine. So you need to figure that out. I think one of the things to consider here, though, is that it's not an all or nothing approach. An employer could choose to pay part of the employee premiums and not. So if you're under 50 employees, for example, you could decide not to pay the employer portion of the premium and then to split the employee portion of the premium with the organization paying half and the employee paying half. So there's a number of different ways to structure this, and you just need to figure out what you're going to do. As I said, always keeping in mind that once you have added a benefit, you need to be sure that you can continue it. The other thing, of course, is this starts January 1st, 2019. And I have to tell you, I was appalled the other day to realize that I was scheduling meetings for the last week of October and seeing somebody who had to sign up about how many days it is until Christmas. A little scary, and it's not a lot of time before January 1st comes up. So you need to get your payroll department prepared to begin reporting employee wages and hours worked starting January 1st. And if you are going to do withhold the employee premiums, you need to be prepared to do that. If you are outsourcing your payroll, the payroll service you're using should be prepared to do this. I know most of them are gearing up to be able to provide this service, but you need to check with them and make sure that they have got that ready and that they are prepared to start doing this. Again, there's some financial analysis you need to do here. I think one of the really positive aspects of this law is that the premiums to employees are not prohibitive. As Jason pointed out, and as the infographic talks about, an employee is making about $50,000 a year. Their premium will be about $2.40 a week, or if you're looking at a biweekly pay period, you're looking at $5. So it's not prohibitive, but there are some positive aspects that the employer wants to pay part of those premiums. And then, of course, there's some communication that needs to happen here. You're going to need to let your employees know what's going on. Let them know if you're going to be withholding the premium so they're not surprised when they get that first paycheck after January 1st. Letting them know how much the premiums are going to be. And if as an employer you're going to be paying any of those premiums for the employees. I do want to let you know, one thing to remember is that if as an employer you don't pay the premiums, it does not change the benefit that the employees receive. So just because you're a small employer and you choose not to pay the employee portion of the premiums, your employees will still be eligible for the same benefits as everybody else. So a couple of things to keep in mind there as you consider that. The other thing to be aware of, and one of the is infographic, and there's a picture of it on the slide. This isn't prepared by ESD. It's a very basic informational piece that you can use to communicate with employees. So it's on the website. You can download it, print them out, hand them out to employees, and use that as a basis for your communication. One of the things I would be careful about, I know employees are going to have a lot of questions about what the benefit is, what they're going to receive, how does the application process go on, et cetera, et cetera, et cetera. At this point in time, because so many of those rules are still being developed, I would recommend not sharing really detailed information with employees unless it's something that's already been decided and you can share it with confidence. Otherwise, I would give them the basic information, knowing that more information is going to be coming during 2019 in terms of what the application process looks like, what the benefits look like, how somebody applies for this, et cetera, et cetera. That's the basic steps that you need to take. Jason, do you have anything to add to that?
No, I think that was great.
Okay, then we'll turn this back over to Pragya and we will go into a question and answer session.
Thank you, Jason. Thank you, Claudia. Thanks to everyone who submitted their questions. We did have questions that were sent in ahead of time, and definitely more that kept coming in during the webinar. So as you're listening to the answers, if you have more questions, please feel free to keep adding. And there we'll get started. You will realize that there are some questions that were answered during the presentation. However, because these are questions still, we'll just reiterate so that it clarifies what was covered.
All right,
Jason, you want to get started?
I will. I'll repeat the question just so everyone kind of knows what we're talking about here. So there's a question about the $3,000 grant. The question is whether that grant is annual or per event. That's a great question. The answer is you can apply for a grant for each employee that takes leave. So every time someone applies for leave, the employer can apply for a grant. And then there is a maximum of 10 applications per year. So you can apply one time for each employee on leave up to 10 times per calendar year. From the webinar, are Washington employees of employers who are based out of state eligible for the leave? Yes, they are. Even if the employer is based out of state, if they have someone who works full-time and lives in the state of Washington, then they are required to participate. We, for the purposes of counting the employees, for whether they're a small business or a large business, and the grant eligibility, we will only be counting employees who live in the state. So obviously, if there is a national chain that only has one store here in Washington, we would only count the employees who work at that store. So that's not a great question. Thank you for that. How long do employees need to wait until they receive a check from ESD once they are using the plan? We are required by law to issue the first payment within 2 weeks after the claim has been approved, and then at least bi-weekly thereafter. So within 2 weeks of the application, and then every payment needs to come within 2 weeks or less from that first check. There will also be likely, and again, this is kind of in the early phase of discussion, so this is not final yet, but there will be some kind of regular check-in that the employee will need to submit to the department while they're on leave. We're not sure yet what that check-in will look like, but it'll be somewhat similar to what unemployment insurance requires. You know, to check a few boxes and make sure that they are still experiencing the event that qualified them for the leave in the first place. because especially on the medical side, once the employee has recovered from the serious health condition, they are no longer eligible for the leave. So they don't get automatically 12 weeks just because they, experience a serious health condition. They are only eligible for the leave that they need to recover from that condition. Do part-time employees and or salaried employees with less than $300 per month qualify for this? So the eligibility is based on hours worked. It's not based on wages. It's not based on how much you pay in premiums. It is only based on the 820 hours requirement. So if you're full-time, if you're part-time, if you're temporary, what your status is does not matter for eligibility. If you work 820 hours in the qualifying period, then you are eligible for the benefit. Can employees use vacation or sick banks before using the state plan? I heard that an employer cannot true up leave to supplement for time off not covered by the paid family leave plan. So an employee can use their sick leave or vacation leave before they apply for benefits under paid family and medical leave. But so we are still working out a little bit how FMLA and this new program work together. I think what we can say though is that obviously if you are using your paid time off, your vacation leave, your sick leave, then the job protection, if any, that you are receiving, assuming you're eligible for it, that is not coming from paid family medical leave, that's coming from FMLA. And since the two programs are designed to work concurrently, your allotment of job protection under paid family and medical leave would also drop. So the employee could potentially receive the benefit under paid family and medical leave, the financial benefit, after they take, let's say, 6 weeks of paid time off, and then they want 6 weeks, or let's say 12 weeks of paid family and medical leave. They would be eligible for the benefit under paid family medical leave, but they would not necessarily be eligible for the job protection that would be afforded to them under the law. So,
Jason, can we just clarify that?
Sure.
Because I know that's going to be a question. There is a job protection provision with this law, but it matches FMLA. So if you are a small employer with less than 50 employees, you are not subject to FMLA. You're also not subject to the job protection provision under the state paid family and medical leave. So again, for most small employers, you will not have that concern. It's still a very nice thing to offer employees that job protection if you can, but the law recognizes that for a small nonprofit, it's a lot harder to keep a job open for somebody who's out for an extended length of time.
Yeah, that's a great clarification, Claudia. Thank you for that. So the benefit would be available for an employee who is on unpaid leave through their employer, whatever arrangements that a small employer who is not liable for the job protection aspect of the law, the benefit would be available to the employee during whatever leave that they are able to take, that their employer allows them to take. So if they reach an agreement with their employer to say, sure, you can take 3 or 4 weeks off for this, then during that time, the employee would be eligible for the benefit from the state. That's a good point. Thank you for that. Right. I think there was actually a was there a follow-up? Oh, yeah, the supplement. Yeah, there was a question about using paid time off to supplement, to top off the employee's wages. So we are still kind of navigating that a bit. What's the problem that we're running up against is that the statute is pretty clear that you cannot receive wages at the same time that you are receiving the benefit. So if you're receiving wages, then you are not eligible for the benefit under paid family and medical leave. And the way that wages is defined in the law, wages and money that's paid through paid time off is counted exactly as if the employee had worked that day. They are counted as wages. So an employee would not be eligible for the benefit on the same day that they are receiving paid time off. That's not to say that it's impossible, but those conversations are ongoing. What is possible is supplements and top-offs through an internal benefit program. Claudia earlier was talking about short-term or long-term disability programs that might currently exist for employers. The employer is absolutely permitted to use that program to top off the benefit. So if the benefit, let's say the employee earns $1,000 a week, if the benefit from the state turns out to be $750, then the employer could, through one of those internal disability programs, top off with the remaining $250. It will just need to be done in a way that is not classified as a wage so that the employee is still eligible for the full benefit that they receive. Right. Okay, so does an employee have to work 820 with a single employer or any qualified employer in Washington State? It is for any number of employers. So if the employee works 400 hours for employer A and 500 hours for employer B, then that's a total of 900 hours and they're in. So it does not have to be for a single employer. The way that the follow-up question to that is how the employer will know whether they are eligible. So when the employee files a claim with the Employment Security Department to receive the benefit, we will combine all of the reports that we have received for that employee and determine eligibility. So, which is a main reason why we require employer reporting, so that we know how many hours have been worked by all employers for that employee. So if and when the employee files a claim, that's when the eligibility status will be determined by the department. And we will notify the employer when the employee files a claim. So we will be in touch with the employer to make sure that they know that the employee is eligible and will be receiving the benefit. And just to follow up on that, communication with employers is going to be a huge factor for us. We absolutely want employers knowing what's happening with their employee who's on leave, want to make sure that they're eligible and get as much information and share as much information as possible with employers to make sure that they know what's going on and that they're not in the dark. What is the threshold in hours for not having to comply? We have 2 part-time employees and they work less than 4 hours per week. So this is a common question that we get. Eligibility has no bearing on the premium. The employee does not necessarily have to be eligible for the benefit for the premium to be assessed. The premium will be assessed based on all hours, on all wages paid to all employees, regardless of how much they work. Unfortunately, that does create potential for situations where an employee has been paying premiums, and if they have not worked the requisite hours, then they would not be eligible for the benefit. So that situation is a possibility under the law, but we are bound by the law to assess the premium based on all wages paid, regardless of whether the employee might or might not be eligible for the benefit. Is withholding pre or post-tax? That's going to be pre-tax, similar to Social Security and FICA and all those deductions that already exist, so it'll be pre-tax. As far as the benefit payment goes, we are still working with the IRS to determine the taxability of the benefit. That is something that, at least for those on the state plan, that is something that the department will manage for the employee. We do plan to have the option to withhold, to pay those taxes if it does turn out that the benefit is taxable, but we are still working with the IRS on that, and we do expect an answer from them sometime next year. How will this interact with our existing short-term disability insurance? So we've talked about that a little bit. For those on the state plan, there will be no regulation by the department for an employer's internal disability program. As long as the employee is eligible, is able to access the state benefit, that's all we really care about. Whatever supplementing the employer wishes to do, whatever additional benefits the employer wishes to offer through an internal disability program, that's completely up to the employer, and we have no hand in that. So I think that's a common question that we get, but we really have no interest in further regulations around how employers manage their own internal benefits. So as long as they can access the state benefit, that's all that matters as far as ESD is concerned. Best practices regarding childcare benefits. I'm not sure I understand that one.
And I think that may be a question we need to handle separately.
Okay.
Because childcare, I think that's a separate benefit because it obviously doesn't have anything to do with family and medical leave because
Right.
there's no childcare benefit.
Childcare, yeah, there's no benefit to help an employee pay for childcare costs. As far as best practices for general childcare goes, I would love to hear that because I'm expecting in November. So send me your best practices on childcare by all means. Will the premiums be calculated include any supplemental pay, e.g. severance, or just gross pay? It's just gross wages paid. Severance, I don't believe would count as wages. A paid time off, cash out would, I believe. We would count that as any other wage. But I don't believe that a severance package would count as wages because the way that it's defined in statute, it has to be tied to a service and a time period where that service was performed. So an optional severance package, I don't believe would be eligible for the premium. Weighing the pros and cons of having our own policy or having employees buy into the system. Please discuss pros and cons of nonprofit paying the tax for employees. That's probably a Claudia question.
Yeah. And I think we already talked about the question of whether the nonprofit pays the premium for employees. There obviously the pro is that it's very positive employee relations to be providing that benefit. The con is obviously that's going to be an ongoing cost that the organization is going to have to bear. And particularly if the organization grows, those costs could go up over time. So it goes both ways. In terms of having a voluntary program or some kind of internal program, I think the thing to look at is number one, cost. What is that costing you versus what would the portion of the premium that you would pay. If you're a small nonprofit and don't have to pay the employer portion of the premium, and you are now paying premiums for a short-term disability plan, it may be that the state plan would be less expensive and might be the better way to go. The other thing I think you really have to think about is administration. And if you have a voluntary program, number one, you're going to have to submit to the state for the first 3 years. So you're going to have to apply 3 years in a row to get that approved. After that, you wouldn't have to do that unless the plan changed. That does, however, make you subject to audit by ESD. If, for example, there were a complaint that employees were not receiving a benefit they were supposed to receive. The other side, of course, in terms of administration is administering the program yourself. One of the positive aspects of the state plan is that employment security is going to be doing all the administration. Employees will apply to the state will determine their eligibility, the state will determine how much they're going to be paid, and will take care of the payments. There are going to be some reporting and record keeping requirements for employers, but there will be no ongoing administration. So I think you have to look at all of those factors in determining which way you want to go, as well as taking into account what's better for your employees in terms of the benefits package that you're offering.
So we're at 12:59.
Yes, I was about to say, we do have a few questions, still more questions that are coming in. So at this point, we'll just scan through and see if there is any specific or bigger question that we've not addressed till now. And we will also be following up with the slide deck, a copy of the slide deck, and more resources, a recording of the webinar, and also link to the ESD website where there are a lot of questions answered and other resources.
Any
Yeah.
specific question, Jason, that you want to address?
I can maybe just do kind of a lightning round style here, because I do think some of these are fairly easy to answer. Is it likely that short-term disability plans will no longer be needed if this law covers paid sick and paid family medical leave? That's completely up to the employer. If you want to offer additional benefits, you're welcome to do so. This will only guarantee the minimum benefit, but if you want to top off or supplement, feel free to do so. Religious organizations, they are not exempt under this law like they are under UI. So the premium will apply and the reporting requirements do apply. So please be aware of that. Medical requirements that the employee will need to provide. There will be a medical certification required for those on medical leave and also for those on family leave who are taking care of a family member who's experiencing a serious health condition. So we will definitely be offering some more information around that aspect of it, but there definitely will be a medical certification required by a health provider for individuals on medical leave. Okay, I can, yeah, the 820, so I'll repeat that one more time. So the qualifying period is the first 4 of the last 5 complete calendar quarters or the last 4 complete calendar quarters prior to the employee taking the leave or applying for the leave. So when they apply with the state, we will look at that at that first period, which is first 4 of the last 5 calendar quarters. If they've hit 820, they're in. If they have not, we'll then move on to the last 4 complete calendar quarters and examine that period. If they're in that period, we'll approve. If they have not worked 820 in either of those 2 periods, then we will deny the claim. I hope that clarifies the qualifying period a bit.
So we are at time,
time.
right now, and thank you everyone for participating. As I mentioned, we will share more resources. There will be a web page on 501 Commons website with all the resources, information, and more updates as they come along. So thank you everyone for participating, and thank you Jason, and thank you Claudia for sharing your wisdom with us.
Thank you so much for having me.